Okay, I'm going to walk into the room, make sure I gather my equipment, and wash my hands. Wash my hands while also providing privacy for the patient. I'm going to introduce myself. Hi, my name is Taylor. I'm going to be your student nurse today. Can you tell me your name and date of birth? And then they would tell me their name and date of birth, and I would verify that with the wristband. And then I'm going to explain the procedure. So we're going to be doing a clean dressing change today and make sure they're okay with that. And then I would do a safety survey, make sure the bed is lowered and locked, the call light is near them, they had non-skid socks on. And then I'm going to go check the provider's orders and the institutional policy while also teaching the patient about the procedure and answering any questions or concerns they may have. And then I'm going to make sure I do all the assessments I need to do, and a pain assessment, making sure that I am giving them a scale of 0 to 10, 0 being no pain, 10 being the worst pain they ever experienced. And then I'm going to assist them into a comfortable position where I can easily access the wound. I'm then going to wash my hands. And I'm going to don some gloves. And then I'm going to be removing the bandage, making sure I'm starting from the corners using the push-pull method. Pulling from the middle. I'm going to inspect the bandage. I'm going to make sure there's no odor or any drainage. And if there is drainage, I'm going to note what kind of drainage that is. Then I'm going to discard. I'm going to do the same thing with the gauze. Notice any odor or drainage. And then I'm going to discard those. And then I'm going to assess the wound as well, making sure that I look for any signs of infection, such as inflammation, redness, drainage, purulent drainage. And then I'm going to make sure there's signs of healing, making sure that there's no macerations and that it's a meaty red color. I'm also going to measure the wound's depth, width, and length. And then I'm going to take off these gloves, wash my hands, and gather my new equipment. So I'm going to need gauze. Instead of gauze, I'm going to need an abdominal pad, tape, and a pen. Wash my hands again, and saline. And I'm going to don on some more gloves. I'm going to take off bandage, discard, and hand hygiene. And I'm going to be taking saline, maintaining sterility. I'm going to pour the saline on the gauze, wash my hands again, and putting on new gloves. And then from there, I'm going to be using the 4 corners method. And making sure I'm wiping one side of the wound from top to bottom. So cleanest to dirtiest and discarding. And then I'm going to do that again on the other side. Top to bottom, cleanest to dirtiest. And one more in the middle. Middle, perfect. Then we're going to discard, and then I'm going to take off these gloves, make sure I'm washing my hands again. And if the patient is on any medications, I would make sure I do the 3 checks and the 11 rights. And then I'm going to put on some more gloves. Then I'm going to make sure I'm taking dry gauze and opening it. As so. And today we're going to be doing 1 layer of gauze because we're expecting no drainage, but if there was going to be drainage, we would do more than 1. Okay, and then I'm going to take my abdominal pad. Making sure I don't touch the inside and placing that on the patient. And then I'm going to take tape and do the window pane method. Making sure it's nice and secure for the patient. More. Make sure it's nice and secure. Okay. And I check it to make sure, and then I'm going to take off gloves. I'm going to do hand hygiene. I'm going to make sure I discard all of the items that I used. And then I'm going to write the date, the time, and my initials on the patient's abdominal pad. I'm going to make sure I reassess the patient to make sure she's comfortable. They're comfortable. And I'm going to make sure I document.